My name's David Bates and I'm a professor at the University of Nottingham. My speciality is in cancer biology, but my research interests are in how blood vessels grow. What we're going to do is to try and find out what it is that causes blood vessels to disappear in the back of the eye when you get diabetes, because this is what causes a leakage of fluid and excess blood vessel growth, which makes you go blind. When people get diabetes, their eyes make two different forms of the same protein. The protein is called vascular endothelial growth factor, or VEGF. And the reason why it makes those two forms of the protein is down to a process called alternative splicing. And that alternative splicing is controlled by a protein that we're looking for called SRPK1. We know that this is involved in other eye diseases and other diseases where blood vessels grow. If we can show it's involved in diabetic retinopathy, then we can develop drugs, and drugs are already being developed for other diseases that hit this particular protein. So as patients get diabetes, some of them will start to go blind, and once it gets to a particular level, then they will receive monthly injections into the eyeball of a drug called Lucentis, or sometimes Eylea. And this means that they have to take time off work, they have to go into the eye hospital, they have to have a relatively unpleasant procedure where they receive these injections. If we can switch that to eye drops, it means that they can go home, they can give the treatment themselves, they can go and see their optician on a regular basis to make sure that it's working. Ophthalmology and departments and eye hospitals are overwhelmed by the number of patients that need this treatment. It takes time to treat each patient. It's a surgical procedure. It needs an ophthalmologist to undertake it, or a very well trained specialist nurse. This would not be the case with eye drops, and it would mean that both the NHS would save time and money, and the patients would save their time as well.